Now picture this. In every 2 hours, a pregnant woman loses her life to pregnancy-related complications. It is this dark and grim picture that has prompted governors to join hands with the First Lady Margaret Kenyatta in her Beyond Zero campaign to further accelerate the achievement of Millennium Development Goal number 5, which is improving maternal health care for all Kenyan women. The following report was filed by Caleb Mutua.
In Kenya alone, there are at least 1.7 million deliveries every year. Unfortunately, only 35% of the country's health facilities are well equipped to offer maternal health services. As a result, for every 100,000 deliveries in Kenya, over 400 women lose their lives and over 300 others are likely to require emergency services. However, there is a reason for all women and mothers to celebrate. With a 500 days deadline to beat the MDG's deadline, governors have undertaken to improve maternal health in the 47 counties.
As the Council of Governors, we met last, I think, a few months ago when we were when we were engaging the budgetary process. And we indeed agreed that we should mainstream the Beyond Zero agenda campaign, and that we put it as a specific budget line in our budgets for this financial year, because it's not just a campaign, it is a very serious initiative. We therefore declare today that as the first elected governors of Kenya, we shall embrace and jointly own the Beyond Zero campaign in all our respective counties as the First Lady launches mobile clinics nationwide to increase the chances of life for majority of our mothers.
Speaking during the opening of a 2-day consultative meeting on accelerating the attainment of MDG 5, First Lady Margaret Kenyatta did welcome all governors to join the Beyond Zero campaign, challenging them to use their administrative positions to drive the campaign to the grassroots level.
I would want them to take it on as theirs. I'm just the head. I started it, but it's to go down to the grassroots.
Notably, the introduction of free maternity services in all public hospitals, which waived all maternity fees charged in dispensaries' health facilities, drastically reduced maternal deaths, saving the lives of over 600 mothers and 16,000 children.
Such issues actually do impact quite material in terms of numbers of mothers going to those facilities. So in addition to what we are doing, we are putting a lot of emphasis on enhancing awareness, because until those people, those ladies, those women in those areas get convinced that indeed a male midwife can do the same job as a female midwife, then they will still not be going to those facilities for help.
The conference focuses on the 15 counties with the highest maternal deaths, including Nairobi, Homa Bay, Taita Taveta counties in northern Kenya, led by Mandera, Wajir, and Marsabit. Other than medical factors, other challenges that increase maternal deaths include poor supply of electricity, water, roads, and security.
Where unfortunately on 2 occasions, on Sunday and Monday, our emergency medical team, the 2 ambulances were unfairly targeted and unfortunately targeted. So for the safety of our staff, we had said we would stop our work in that area, temporarily suspending, waiting for assurances by the central government, by county government, and by the 2 clans that have been fighting, because the attack was done by one of the clans.
With at least 5,500 Kenyan mothers dying every year, Kenya is among the leading countries in sub-Saharan Africa in maternal deaths. However, most of these diseases and complications that lead to these deaths are preventable. And as the fight against maternal deaths continue to gain momentum at the county level, expectant mothers are encouraged to shun seeking midwives within their localities and instead deliver in hospitals to reduce these deaths.